Unfortunately, we've all experienced great loss that's left us feeling incredible amounts of pain and grief. And if you haven't, please tell me your secret. I'm Clint Malley, and this is Real Common Treatable, where we help behavioral health professionals stay at the forefront of adolescent mental health, substance use, and addiction treatment. So, in this episode, we're going to discuss loss and the emotions commonly associated with it, grief therapy, and 3 strategies to help someone reach reconciliation, and finally, how grief can look generationally and culturally different. Our teacher today is Amy Ruesche, a licensed clinical social worker at Reconciling Loss, a company that specializes primarily in grief and loss. She often works with individuals and groups who are processing death, losses, childhood sexual abuse, and later life assault. Grief counseling is so important and can have such a positive influence on someone's mental health. But grief can be a pretty subjective term. So let's find out what it really means.
Grief can pertain to a lot of different things. There can be a lot of overlap in those different types of grief. For me, grief is just the very normal and expected reaction to a significant life change and having something that you once had and no longer do. And I think that's why I really find it so important to normalize grief, because we oftentimes talk about it like it's this elephant in the room, or that we have to treat someone who's actively grieving and mourning with kid gloves or walking on eggshells, when really grief is just a really normal human response to some kind of significant loss, whether that is a death or a major life transition. Grief is just that process of all of the different emotions that come with that, which I also talk a lot about. But grief is not just a singular experience, and it's not a singular emotion that people feel. I really talk a lot about the impact of words and the importance that words hold in understanding our experience. Is that the reason that the word bereaved is an adjective that describes people, is because once you have experienced grief and have experienced this loss, you are bereaved for the rest of your life. There is no finite time. That's an important part of your identity, just like anything else. And it's not something to be ashamed of or hidden, but can be an important part.
When you experience an extreme loss, it's hard to know how to process it, how long those feelings will last. So what does reconciliation actually look like?
So reconciling is this idea of how do we take both realities, right? How do we take the current life that I'm living and will continue to live, and this extreme tragedy that I'm trying to process and integrate into my life? How can I reconcile those two things and hold them both to be true and to be valid and both equally important? All of my kind of work process is how to help people reconcile that, how to integrate that, and recognize that, especially when you're in your most acute state of the grief, right? Like in the weeks and months, and sometimes even the first year after a death, you're in that really acute state where it feels like this might never get better, and I may not even survive this. It is so painful and so deep. And so helping people navigate that reality that you will survive it. And yes, it's incredibly painful, but we can absolutely find ways to hold both of those things. I've worked with people who are 15, 20, 30 years out from the grief and are still processing parts of it and are still coming to terms with things that they maybe didn't think about or weren't ready to think about closer into the death. And like I say, bereaved is an adjective for a reason. Your grief will always be a part of you and a part of your life. There's no competition or comparison in grief, and there's certainly no time limit.
Grief is such a personalized emotion, and people process the emotions in different ways and at different speeds. So it's important to create a safe space and be an active listener.
Oftentimes, I think as therapists, understandably, we're problem solvers. We like to get in there and say, how can I really help this person move through this process? And some concerns in life, some challenges that we face are really amenable to CBT and DBT. And let's give you all these skills and let's problem solve our way through this. And grief is just not that. I think sometimes therapists who haven't been trained in it miss the mark, is feeling that we need to be in a very active, like doing space, when really so much of grief work is no, you need to sit back and be in a listening space and a holding space and just let these people explore what they need to explore. And of course, I guide people and I support them in challenges that they're looking to have some guidance on. But I'm always very mindful, even with myself, when I feel that pull of, I need to be fixing this. And it is always just a lot of a conversation around, are you sitting with them, being a safe space where they can cry, scream, talk about the complexities of their relationship with this person. In grief, we tend to have this feeling that we have to put this person now up on a pedestal, put on our rose-colored glasses, right? Ignore any potential complexities that likely existed in the relationship, because we're human and we all make mistakes and we all hurt people inadvertently in our time. And are you holding space for all those complexities? Was this relationship really traditionally happy and healthy? They just loved them and there were no issues? Because probably not. There were probably complexities there. So are you holding space for them to be able to explore that and feel safe? But it's just a reminder that that's not our job and that's not the task of grief. The task isn't to sweep away the pain and get it to go away. It's to feel it and to process through it and to get to a place where, like I say, you're at peace with it and can titrate it, as I call it.
While everyone's time limit and experiences with processing grief are different, there are some common emotions that people experience, like guilt.
Guilt tends to be one of the primary ones. We talk from this space of hindsight bias that makes us feel all of these different things. A lot of guilt and shame around, especially more kind of complex types of death losses, particularly like suicide deaths, can come with a lot of questions and doubt and guilt around, what did I say, what did I do or not do? I've worked with people who have had someone die from cancer and have felt, had I changed their diet a decade ago, this wouldn't have happened. And guilt is also a primary one because of the just totally chaotic and surreal reality that people are living in. Their brain is seeking some kind of order and understanding, and guilt is what provides that for us. If we can say, if I had done X, Y, or Z differently, this wouldn't have happened and my person would still be alive, that brings a sense of like control to that situation.
Or anxiety.
One that people don't think about, but is super common as well, is anxiety around, when is the next death going to happen? Is that next death going to be me? Is my child going to die? Just a lot of anxieties related to death and having a lot of increased fear around activities that might potentially cause harm in some way.
Depression.
I have a lot of people who have said that one of the most unsettling parts of their grief has been this really intensive depression that they've never experienced in their life. Now they're having a hard time sleeping, or they're sleeping too much. They're having a hard time getting out of bed, getting motivated to do things. And again, this is where grief is such an interesting situation, where sometimes the lines get very blurred. Again, if someone's maybe not properly trained in identifying grief, it can be very easy to say, oh, this person's just depressed. But sometimes it may not really be appropriate to clinically assess it as depression, as in, I'm going to diagnose you with depression, so much as, well, yes, you're depressed because your child just died. Who wouldn't be depressed in that situation? And so there can be blurred lines between what I would qualify as a clinical depression versus a situational depression, which oftentimes grief can be. And conversely, the grief can initiate the depression. And sometimes for people, that depression might last the rest of their lifetime and it might become a more clinical state.
Anger or irritability?
A lot of the time, I think just because of the intensity of what they're experiencing. Again, a really common way of hearing it described that I get from my clients is, my skin has just been pulled back and I am just raw to the world. Like any little thing that touches me can quite truly rub me the wrong way. Like things that I normally would have just totally let go, not been a big deal for me, now just feel like I could just lose it on someone. I could just snap over this thing. I think that Oftentimes that can also come from what we call spiritual bypassings and platitudes. So spiritual bypassings are things like God had a plan, or God needed another angel, or that there's a higher reason or a higher purpose for why this happened. And that can elicit a lot of anger in grievers, whether or not they identify in any kind of religious or spiritual way, because again, try telling a grieving parent, who I've had this experience of telling a grieving parent, well, it's okay. God now has your child and you'll be fine. I have also had grieving parents who have been told, you can always have another child. And yeah, who wouldn't have an anger response to that? And these platitudes and these bypassings and these, frankly, just hurtful things that people say out of their own discomfort of being around a griever and not knowing what to say and not knowing how to handle it can, elicit a lot of anger and irritation in people. And I oftentimes, when I'm educating community members, I say, go back to your kindergarten rules. If you don't have anything nice to say or you don't know what to say, don't say anything at all. Just sit with them and just be with them, because you might say something really hurtful.
Or even bitterness, resentment, and jealousy.
So a lot of those come into play when you're moving through the world in grief, right? And you are at a park and your parent recently died, and then you see this happy family playing and laughing and being together, and you're just suddenly filled with this real jealousy or resentment that these people still get to have this connection with their person and still get to have these relationships that you will never have again. Because again, whether it's a parent or a sibling or a child that has died, no matter what anyone says, these people are irreplaceable, right? And once that relationship is lost, it's lost forever. And just a lot of that jealousy of getting to see other people having what you no longer have. And oftentimes the bitterness comes just from a plain and simple place of feeling that life is unfair. How deeply unfair was it that this happened to me? And why did this happen to me? And those are, of course, fair questions, even though, again, we can logically know that life is not fair. And of course, unfair things and hurtful things happen. But that doesn't change the reality that it's still really painful for the griever and can bring up a lot of those feelings of bitterness.
Now that we know more about the common emotions people experience after a loss, let's get into the 3 primary strategies that you can use to help a client work towards reconciliation. Strategy 1 is provide people with tangible coping skills.
Providing people with, tangible coping skills, because oftentimes a big part of my work too is managing expectations. That I understand you're coming to me in a lot of pain and you want me to give you some magical solution that will make this pain go away. And that's not how this works. And so where are at least some things that I can give you, these skills that you can really kind of put your hands around and feel like, okay, here are things to help me fall asleep at night, because sleep is, such a big disruption in grief. And here are things to help reduce anxious and depressive thoughts. And here are things to help calm my nervous system when I get really activated in my grief. So giving some of those tangible coping skills.
Strategy number 2 is to sit with the feelings and talk it out.
But then the other part of it, which is where I sometimes have to ask people to have some patience and bear with me, is just sitting with it, talking about your person, talking about the death, talking about the pain. I always use the metaphor of a wound, right? When we fall off our bike and we get a cut, we have to put the antiseptic in and it burns and it is really not fun. And we don't like that process. But then that's how the wound heals cleanly and doesn't get infected and doesn't cause us lifelong problems. And so the grief is similar. Talking about it and sitting in the pain is the antiseptic that helps clean out the wound. So one thing that I have currently going on in one of my groups is this commonality of substance use and addiction. And one of the group members even said, they were like, this is the first time I have sat in a room with people who are willing to openly admit the challenges in their relationships with the person that died and say, yeah, they were an alcoholic. Yeah, they abused drugs. And I loved them and they were my parent and I had a really special relationship with them. right? And feel that is a safe space for me to be able to just really openly talk about that and process that. It's not a betrayal of the love that they feel for them to say, also, here were these really challenging things. We can healthily integrate it and make it a part of our life rather than just something that is a constant pain and sticking point in our life that feels really uncomfortable. And sitting with death brings this like really intense sense of gratitude and connectedness to your life that makes it that death is less of this really terrifying thing and more of, yeah, it's an inevitability and it's going to happen and there is no avoiding it and there is no changing it. So how can I navigate it in the best way possible?
Strategy number 3 is to reassure and normalize mental health. So when you're talking to someone of any age group, it's important to remember that we're all human. And as humans, we seek reassurance that what we are feeling is normal.
I tend to do a lot of, just like normalizing. It's great that you're here. Thank you for taking this step. I know it can be really hard. And just really normalizing a lot of those common responses and like mental health pieces of grief so that they feel, that it's nothing is wrong with them. They haven't failed in some way. They're not really abnormal or struggling with something that a lot of other people don't struggle with. And I do a lot of that normalization with everyone, regardless of their background with mental health care and with where their awareness is, because there's a lot of things that happen in grief that people will come to me and say, I feel like I'm losing my mind or I'm going crazy. And then they tell me what it is. And I'm like, oh yeah, no, that's absolutely a very typical thing. Just as a quick example, short-term memory loss, like super common in grief. Your memory just goes out the window. You can't remember anything. That's a very unsettling thing to have never had any memory issues. And now suddenly you put your car keys down and you cannot for the life of you remember where you put them. And so then when I say, oh yeah, no, absolutely, that's totally normal, there's this like visible sense of relief. I'm like, okay, and it's gonna pass. My memory will come back. Like this is an early stage of dementia. This is just grief. And it's just part of the process.
Unless managed and processed healthily, grief can begin to weigh down on a person and negatively impact their mental health. And although mental health has become more mainstream and the stigma surrounding it have lessened over time, we still see some generations more open to discussing mental health than other generations.
So far, there's been a fairly clear line for me of age group. And if I'm working with people under a certain age, they tend to be more aware of mental health, sometimes almost to a problematic point, right? Like I've had to sometimes say, I hear that you learned this thing on TikTok, and let's not start self-diagnosing with all of these various that you're hearing about on social media. But one of the positives is that they do tend to be more, self-aware around their own mental health, around mental health in general, don't tend to have a lot of stigma around talking about these things. Whereas, sometimes with some of my older clients, for a lot of them, this is their first time in therapy. And they come in saying, I have never been into therapy. I never thought I would be in therapy. But this death has pushed me past my threshold of like my own skills and my own capabilities of what I've been able to handle in the past. And so now I'm recognizing that I really need some additional support. And so, in those cases, I tend to take things a little slower.
Different societies even handle death and grief differently.
I think a lot of it is the socialization around death. If we look at different cultures and how different cultures handle death, it's not that way for everybody, right? There are some cultures that handle death really beautifully and really know how to handle it and how to support their grievers and show up in really meaningful ways. I talk with a lot of clients who have expressed that frustration of, I feel that in America, we just don't have this like willingness to sit with the discomfort and with that reality. A lot of us tend to like to have this belief we will never die. And again, we can of course logically know that's not true, but there's something about the American ethos that just is really death avoidant and really doesn't want to deal with that. Whereas let's take a trip to Australia where the societal and cultural norm is after someone has died. So the night of the death, your community rearranges their furniture in their home. And it's a representation that when you wake up the next morning, nothing in your life is the same. And we recognize that there has been this really big shift, right? And that is represented by the fact that nothing is where it once was. And we now need to adjust to, oh, my TV's over there instead of over here, right? And my couch is now at this angle. It might sound like a silly or trivial thing, but it's when you really reflect on it, it's such a beautiful way of your community showing you that they understand what you're going through. They're ready to be with you on that journey and to sit with you. In the Jewish community, we sit Shiva for 7 days, where you just sit in silence and you're just with the griever. Nothing is asked of them. You're not expected to cook for the people that are in your home. You're not expected to even talk if you don't want to. But you just sit and you are with the people who are grieving and are mourning this loss. I think that we have a lot to learn from various cultures around the world and various religious and spiritual traditions of how to better show up in those moments. Also, the more you sit with it, the less scary it becomes in a weird kind of way.
So now that we know common emotions associated with grief, different strategies to process it, and how different age groups and cultures handle it, how do you know that grief therapy is right for you?
I would say to anybody who is on the fence or maybe thinking about grief therapy, but oftentimes I find that what the narrative tends to be, but I'm doing okay. I've found my coping skills, or I've found these ways to navigate through this. My sort of challenging question to that would be, but are you really happy, right? Do you really feel that the things that you're doing are sufficient and are feeling supportive enough? Sometimes we get so used to our baseline that it just feels that's fine and that's okay. But we could potentially be feeling so much better. We could feel that we've had a really great way of expressing this grief and really being able to share about it and attain this better integration of it in our life, which can lead to more meaningful relationships, more meaningful experiences in life.
Yo, but I don't want my friends and family to find out. I don't want people to look at me differently because I need therapy to help me process loss.
There is no kind of judgment or shame in getting grief therapy. I think also sometimes in this process of destigmatizing mental health, we talk so much about trauma and depression and all of these different things that oftentimes grief doesn't get put on that list. And so people might feel like this really isn't like important enough to need therapy for, right? I might not actually really need this therapeutic support in this particular thing because like people die all the time and people grieve and you like, this has been happening literally since the beginning of time and you just deal with it and you get through. And I think I would especially add the caveat of for men who tend to be told this narrative that don't cry, don't feel it. I just literally had a male client tell me that they've been told to suck it up and deal with it. And so knowing that that is not true in any capacity in life, and especially not with grief, there is no need to ever put it aside or think that it's not important enough to have your own space to really feel it and dive into it and process through it. And one of my favorite quotes from a book, it says, "As surely as we are born into this life, we will suffer a loss before we leave it." And, everything that you have felt and experienced has been felt and experienced by someone else, but that doesn't mean that your experience isn't special and unique and important in its own and doesn't deserve its own space and time. You can touch your grief and then you can go have fun with your friends, and you can touch your grief and go engage in relationships in really beautiful, meaningful ways. And those things can all beautifully coexist at the same time. And it doesn't have to be, I'm fully grieving or I'm fully happy. We can hold both.
As we have learned, grief is one powerful emotion. Everyone processes loss differently, and it's important to be a supportive listener as a client navigates their own route towards reconciliation. Hey y'all, this grief thing, it's real, and it's also more common than we think. But thankfully, with the help of professionals like you, the trauma associated with loss is very treatable. So go empower and inspire change today. All of my love, and I will see you on the next episode.